Welcome back to Sleep Better TV. I'm Scott Drake. Today we continue our discussion with the members of the Mid-Wilshire Dental Care in Los Angeles, California. We have the pleasure of Dr. Mark Laska on the phone. He, by the way, is also the official dentist or dental professional of the Los Angeles Clippers in the NBA. Dr. Laska, welcome back. It's good to talk to you again.
Well, good talking with you again, Scott.
What types of problems do NBA players typically have? Are they same as everybody else or just bigger?
Pretty much so. They find a little bit more difficulty sitting in the chair. But other than that, they have the same problems that all of us have. In fact, one of our players apparently has sleep apnea.
Really?
So we're going to be dealing with that very shortly, too.
Okay. And that's exactly what we're talking about. Has Doc Rivers shown up yet at your office?
No, he has not. It's a little bit too soon for that.
Okay. All right. Well, Dr. Laska, today we are talking coincidentally about snoring and sleep apnea. We'll start right at the beginning. What are sleep breathing disorders in general?
Well, sleep breathing disorders are respiratory problems that occur while you are sleeping. They can range in severity from mild snoring to severe sleep apnea. A sleep breathing disorder is the result of an obstruction in the oral or nasal airway. As you fall asleep, your airway relaxes and can collapse on itself, creating the obstruction that results in a sleep breathing disorder. Sleep breathing disorders are widespread and can be severely detrimental to a sufferer's health.
And then talking about how one knows if they might be experiencing a disorder of that kind. Typically, it's a bed partner. Talk about how snoring and sleep apnea are actually related.
Well, snoring is considered to be a sign of the onset or the existence of a sleep-breathing disorder. So the sound made when a sleeper is snoring comes from the tissues of the throat relaxing and then resting against one another, vibrating as a sleeper breathes. This is considered a partial obstruction. For those people who snore, typically about 35% of them have obstructive issues as well, the most severe being sleep apnea. An apneic event is the complete obstruction of the oral airway for 10 seconds or longer while sleeping. We can now use home sleep tests to get readings on a patient's sleeping habits, including if they snore, how loud they snore, or how many apneic events they have in a 1 hour period of time.
Okay, and it seems like every day we read the news and there's some new health risk associated with sleep apnea. Can you talk about maybe at least the most widely known risks associated with OSA?
Sure. The recent studies that we're getting now suggest that stroke, heart attacks, high blood pressure, diabetes, dementia, and even cancer can be linked to sleep apnea. And because of restless sleep during the night and daytime drowsiness, one can be more prone to accidents, and especially automobile accidents. One study at the University of Wisconsin indicated that over an 18-year period of time, people with untreated sleep apnea had a higher mortality rate than those without sleep apnea. In those mild sleep apnea, it was about 10% higher. Moderate sleep apnea was 20%. And for those with severe apnea, it was over 40% higher. That is a staggering number.
And just to elaborate just a little bit on sleep apnea, when one has sleep apnea, it's very common for them not to get enough restful sleep. And there's some other side effects that are fairly undesirable, and one of them typically is also weight gain, and which is something that people, especially in Los Angeles, I'm sure are always trying to fight. So there are a lot of things associated with that, and I'm sure people watching this are thinking, some are thinking, so I didn't know a dentist had anything to do with treating a sleep breathing disorder. How do dentists treat OSA?
Well, as a dentist, after sleep apnea has been diagnosed by a sleep specialist, we can actually fabricate an oral appliance. Oral appliances are quite effective in mild and moderate sleep apnea. There are more than 100 different types available. Most of them have the same philosophy of advancing the jaw forward, thus bringing the tongue forward so it does not obstruct the oral airway. In our office, we choose from about 4 or 5 different appliances, depending on the needs of the patient. All of these appliances can be used for sleep apnea and or snoring and are FDA approved.
And would it be safe to say that these kinds of appliances are used typically, and they're very, very effective too, especially in mild to moderate cases, and in those cases where people typically associate sleep apnea with the CPAP machine, and very often those things are very difficult to tolerate.
Right. Yes, they are. In fact, it's been shown that about 75% of the people who have sleep apnea or who have CPAP machines actually never use them. So even though they're quite effective, if you're not going to use them, they have no effect whatsoever. So that's where the oral appliance really is effective, because it's much easier to use. And generally, even in severe sleep apnea, it can be almost as effective as the CPAP is.
Mm-hmm. And I'm guessing when you were talking about an NBA player who's traveling all the time, something like that is much, much better, probably, and easier for them to use.
Right, because it's really difficult to carry a CPAP machine with you when you are traveling.
Mm-hmm.
And being an NBA player, they're traveling all the time, so it would be almost impossible for him to be carrying that with him.
Right.
Whereas the oral appliance is fairly small, easy to travel with, and as I said, it's just as effective as the CPAP is.
My guest is Dr. Mark Laska with Wilshire Dental Care in Los Angeles, California. It's always nice to talk to you, Doctor. Thanks for joining us again.
Thank you, and it was really good speaking with you again, too.
And you're watching Sleep Better TV.